So we're going to do a compression, decompression of the TMJ using the mandible. So if we're lining up the head where she is, the mandibular ramus is the flat part underneath the cheekbone. So get your finger pads, and I like to use my pads like my fingerprints underneath the cheekbone, right on the ramus of the mandible. Can you see okay? And we're going to compress. To compress the mandible, we're going to do like a superior glide, pulling the ramus up, meaning superior. And then an inferior glide or a decompression, pushing that pubic ramus down, meaning toward the feet. Now for the compression, I like to be a little more on the angle of the mandible here, so I have a little hand hold. Compress slightly, wait for a still point, a minute and a half or so, and then fingers right flat on the ramus of the mandible, decompress. So straight inferior glide, if you will. Now I like to make sure they don't have anything in their mouth because A, I don't want them to choke laying down, and B, if they have something in their mouth, even if they say, oh, I'll just tuck the gum in on the side, they're holding tension in the jaw. So just relax. So here's the angle of the mandible. You're going to feel a slight pressure of me pulling your jawbone up towards your head. It should not hurt. If it hurts, I need to know, okay? That's the thing. If you're giving them pain, they might have, there's a little disc, okay, fibrocartilaginous disc in that TM joint. And if it's fragmented or torn and you compress it, they might get a very sudden, sharp pain. So everything is done gently. I'll assume you have examined the TM joint before you're doing any of this. So you just feel a little pressure. You can just rest your eyes, close your eyes. Now as I compress up, I notice the whole right side of her jaw is elevated compared to the left. It's actually hiked up. I don't know if you could feel that. Feel any difference in pressure in your jaw joint up here when I'm doing this? Mm-hmm. You okay with that? Mm-hmm. And it's hard for people to talk when you're holding their jaw closed. How much pressure would you say I'm putting on you?
Very light.
Very light. She can talk. So here's the point. If the patient can't speak because you're jamming their jawbone closed, you missed the boat. This is very light. So I'd wait for that compression, get a little still point, about 90 seconds, and then decompression. Now I'm coming up a little above the angle of the jaw, but below the cheekbone, the zygomatic arch. And now we're going to decompress by a straight inferior glide. So I'm pushing that way toward the feet. So it's just a straight decompression, and I'd hold that until it's softened. And it's a wonderful reduction of their headache if it's caused by clenching the teeth, which many people do, bruxing at night. And if they're uneven like this, you think it would be a great idea for her to see a dental specialist who works with TMJs and might check to see maybe her teeth are uneven. That's called malocclusion. That might be making the jaw go out of alignment. Maybe she needs a filling in a tooth she let break. Right? Maybe her teeth are crooked, need to be adjusted. You know, any number of things. Maybe years ago she was playing sports and got hit in the face with a ball. And it tended to put her jaw off center, but because she was young and she compensates real well, it was fine. And then years later it's starting to tighten up and she doesn't know why. And these are common things. What are you thinking?
16 stitches in my chin when I was 16.
16 stitches with in her chin when she turned 16. There you go. So you'll find people will start to remember things. Oh yeah, that was that. And I feel that just loosened up a little bit right there. And she can feel the release. So what do? I point it out to the patient. Oh, did you feel that relax right there? Oh, did you feel that move right there? Because we want to make sure that she tunes into this as well. Very soft open and close of the mouth. Open, nice and easy.